Welcome to my podcast. Today I'm going to talk about another case. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask the patient, how can I help you today? So the patient might say, I'm having pain in my wrist. I can't move my wrist. I'm having tingling sensation. I'm having pins and needle. I'm having swelling, all sorts of things. So you're going to tell her, can you tell me more about it? If the patient struggled to add any more information, you could have asked, did you have any history of recent trauma? Did you fall down? Did you slip, trip? How it happened? Anything triggered the pain? Anything relieve it? Anything associated with it? Any fever? Any temperature at all? Any nausea or vomiting? Any other symptom of the body like the eyes or pain in the wee. So all of that you need just to ask, just to come to some differential in your mind. And then you will ask, have the patient notice any swelling or discoloration in the skin? Is the patient able to use the wrist and grip with their hand? Is there any stiffness at all? If the pain get worse at night, if there is any lump or bump around the wrist joint, if there is any snap or sharp pain or popping. So all of that would help us with the certain differential. For instance, if the patient has a sprained wrist or inflammation in the tendon, or if there is pressure around the tendon, which could fit with carpal tunnel syndrome, and you can ask the patient to do the prayer sign, which will increase the stretch and cause tingling and paresthesia. If there is any swelling or rounded projection in the dorsal aspect, which could point out to ganglion, basically. And if it's all of a sudden and with popping and snapping, it could point out to broken bone in the wrist region. Especially if it's elderly and she say, I fall on my hand or I fall on my wrist. So that could point out to the differential you could have think of. And also you'll tell the patient after taking the history, you will of course inquire about any past medical history. Let's say, for instance, if the patient is diabetic or has any long-term illness and is taking medication in the long run, like for instance, certain antibiotic could cause tendinitis or tenosynovitis. Also, you will ask if the patient had any thought or ideas what might be the cause for their problem, because the patient they are their doctor themselves, so they will know what might be the whole story about. You will ask also about any known allergy, for instance, and if there is any family history of known illness that could run in the family. And of course, you will ask about the lifestyle, because some patient maybe they are into fitness class or they do a lot of exert work. And you'll ask what sort of work they do. Maybe they're lifting a lot of heavy object or doing a lot of activity, which could cause this issue. And also, of course, never to forget about asking about drinking habit and smoking. And then you will examine the patient wrist. Basically, you will observe if there is any deformity, if there is any skin change, if there is any abnormal thing that doesn't seem right. Then palpate for any tenderness, for the temperature, for any, also check for the pulsation as well. And if there is anything that doesn't seem right, you just need to record it. And then you will agree with the patient a management plan. So you will tell, for instance, you need to rest the wrist when it's in too much pain. You could apply ice pack, which is basically a frozen piece wrapped in a towel. And you could apply that for 20 to half an hour, and you could repeat accordingly. which could ease the pain. Also, ask the patient to try to do some gentle movement, not to leave the wrist in one condition, which could cause stiffness, which is very important, of course, because some people they won't not tell you that. So, also ask the patient to take simple painkiller if there is too much pain, just to ease it. If the patient wearing any jewelry, should be removed in order not to hinder the hand, especially if it's swollen. And ask the patient if they are doing too much activity by hand, they need to refrain from that. You could, of course, advise about grip bandage or splint, which could help with the pain and ease it. And tell the patient not to apply any heat, which could worse and make the condition more worse. And avoid using the hand for heavy load activity. And then, of course, according to the situation, you will treat. And also never to forget about safety netting the patient, say if there is any worse in the condition, if the wrist did not improve, if there is any other symptom or new one developed, if you hear any popping noises or snapping, if you are not able to move the hand, anything doesn't seem right, just come back again or go to the A&E. So I hope by that I touch upon about wrist pain in general and how you can tackle it. Thank you.